All right, I know many of you guys love coffee as much as I do. We have a couple more weeks to win this Nespresso, the same unit that I use at home. Lots of different options available. Some are organic. It's a great way to get better for you coffee and easy way to win. You can always check in for your regular appointment. Doesn't require any really major extra effort. When you're on Facebook, looking at your phone, you're in here for your appointment, check in. We certainly appreciate it. That's one ticket. If you can find it in your heart to give us a 5-star review on Yelp, on Google, even on Facebook, we'd be happy to give you three tickets to win. Right now, we got a couple in here. I'd love to see you be the winner. Please help us out and help yourself out. Thank you very much.
Hello guys, this is Priscilla from Ski Chiropractic. We have a website where we have a lot of information. So we have videos on patients and have their journeys and how they've gotten better since they started care with us. We also have our exercises, products we love, new patient intake forms. So whenever you want to refer someone in, you can always request information as well on our website. So you guys have an awesome weekend.
Ski Chiropractic. So most of you should have this paper. If you have lost it, please let one of us know so we can get you your exercises reprinted. So once you start here, we give you some customized exercises based off of what you came in with and off of your x-rays as well. So that way we can continue to keep making you stronger and better every single time, okay? So if you happen to lose this, please let one of us know. Also, when you're back here in the Vibe area, as you see, I have a couple of different brands: red, blue, white. It should be white, which is 4th of July, right? This one's green. Red's easy, blue is medium, green is hard. So if any of the doctors ask you to do yes, no, maybes, you're gonna grab one of the bands. I have them back there. It goes over and behind. And so most of the time, most everybody, you're gonna hold on to the handles like this, and you're gonna push down and out. So kind of down like this. So we call them yes, no, maybes. So yes, no, and maybe. That's one. We're gonna do it again. So we're focusing more on the range of motion as to speed, and it doesn't really matter what order you're doing it in, just as long as you're doing the repetitions, okay? So we're gonna start off, we're gonna do 3 sets of 10 starting off. I want everyone to start off with the red band. We're slowly work up to the blue and then the green, okay? You guys have a fantastic week.
Are you on your phone, Dr. B?
No. Yes, maybe. You know what? We can't avoid being on phones, right? But we can counteract the position that we're in while on our phones. Very bad for the neck. We want to be in this. We want to be supporting this proper curvature in the neck of the spine. And when we're down on our phones, we take that curvature away. Improper function and structure leads to interference with the nerves. So we want to do those neck rolls that we talked about. So in the office, we use the Denner roll. All right, so we go on the back, right underneath the top of the shoulders, base of the neck. So you get that good support, good curvature in there. Now, if you don't have one of these at home, we can use a rolled up hand towel, or I use a actual body towel, bath towel, because I have a little bit longer of a neck, all right? So for me, this is not gonna work. Doesn't do anything, doesn't even touch my neck. This is gonna be way too big. Oh, I have a roller at home. Yeah, that's like I'm lounging on a bench. No, not gonna work. So something, you know, about yay big, maybe a little bit bigger, support that curve under there, and laying up to 20 minutes a night or a day, whenever you can. So reintroduce that curve, because it's gonna be really helpful, very beneficial to counteract when we do this. Can we avoid that? We really can't, unless you want to stand or sit like this all the time. Okay, here we go.
Hey guys, Dr. Utash here, Wellness Key Chiropractic. Time to refocus on nutrition. Let's start with sugar. So sugar, we all know that we eat too much. We all know it's bad for lots of reasons. Let's kind of dive in deep so that way it really kind of burns a little spot in our brain. So the next time we pick up that sugary thing, we know what that's going to lead to. So first of all, sugar is one of the main causes of obesity, right? Excess sugar turns into fat. The worst time that you can consume sugar would be late at night, because your body doesn't have any time to burn it off, and so it's going to store any excess sugar calories, simple sugars, as fat, typically around the midsection, which is the not so good fat, right? Second thing, sugar increases the acidity in the body. Most disease thrives on an acidic environment, so sugar does not help that cause. Number 3, inflammation. Again, inflammation, all those aches, the pains, those things that are annoying. If you're a new patient here, certainly you probably came in with some sort of problem, ailment, issue that's been bothering you. One of the best ways to recover faster is, of course, stay on your track with your adjustments, but then cut the sugar. As you cut the sugar, you're cutting inflammation, your body's able to speed up the recovery and the healing process. Sugar is obviously the prime reason for high cholesterol. Cholesterol is almost like a spackling, and so your body produces more cholesterol to tackle inflammation. Inflammation, of course, is driven up by excess sugar and stress. Sugar causes hormonal and metabolic imbalances, metabolic syndrome, and so again, one more reason we don't need, especially if you're going through menopause or puberty, not a great time, or maybe even certain times of the month, those are not great times to have excess sugar. It's going to have bad effects on your hormones. Fast track to diabetes, obviously excess blood sugar, you're going to burn out your insulin receptors, you're going to burn out your pancreas. Again, that leads to diabetes. In fact, we have more type 2 diabetes, which used to be called adult onset, we can't call it anymore, because of the large amounts of sugar that people are consuming on a regular basis. And then sugar is a known toxin. There's an entire 60-minute video on that, on sugar is actually a toxin to the body when it's consumed, as many Americans are consuming it right now. Heart disease, again, for the fact of inflammation and acidity. Again, you're going to have less pliability of the blood vessels, and so you're going to have more issues with heart disease. And of course, it's an anti-nutrient. So when you consume a lot of sugar, your body actually has to work harder and dump out minerals and other things that you actually need in your body to help you dispose of that sugar properly if you can. And of course, sugar feeds cancer. Sugar promotes cancer. We've known this for decades now. We know that cancer cells have more sugar receptors, and so we know that when we have PET scans and we inject radioactive glucose into you, it goes to the quote-unquote hot spots. Those are those cancer spots inside the body, and so we know the best way to kind of set yourself up to be a cancer killer, a cancer fighter, is to reduce the amount of sugar that you're consuming. So if sugar is that bad, what's worse than sugar? And it's the fake sugars. And so maybe you're already a health nut and you've been doing protein powder, but you look in there and you see it's full of aspartame or sucralose. These fake sugars, they try to trick your body into making it sweet, but that trick doesn't work, right? And so whether it's leukemia and lymphoma, again, look it up, you'll see that there's a greater incidence of those people who are consuming those diet drinks. They have a greater incidence of those types of cancers, headaches, seizures, sleeping issues, all from these artificial sugars. So sugar's bad. What's worse than sugar? Those artificial stuff. Check us out on the next video as we talk about toxins. Hey guys, Dr. Utash here, Wellness Key Chiropractic. Many people suffer with low back pain. If you're one of those people, you know that that simple low back pain can affect every other aspect of your life. And so here's a simple muscle activation that you can do anywhere that many of our patients have found alleviate some of that low back pain. So perhaps this works really well if maybe you're starting to get that stooped over posture. And so rather than just trying to force it up with your low back muscles, squeeze the glutes, really suck in the tummy, hold it there for 5 to 10 seconds, and then relax. Repeat 5 to 10 times as necessary, and you'll realize the activation of the glutes can actually decrease some of that back pain. I hope this helps. Dr. Utash, Wellness Key Chiropractic.